everyone. Today I'm here with Dr. Melanie Goldfarb.
Hi, Lauren. Thanks for having me.
Dr. Melanie Goldfarb is the Associate Professor for Surgery and Director at the Center for Endocrine Tumors and Disorders, part of John Wayne Cancer Institute at Providence St. John's. Today we're going to talk a little bit about symptoms, diagnosis, and types of thyroid cancer. So Dr. Goldfarb, let's start with the basics about thyroid cancer. Most thyroid cancers don't have symptoms. So if there are any symptoms, what are they like?
So thanks, Lauren. That's completely accurate. Thyroid cancer generally doesn't present with any symptoms. You can sometimes have, if your cancer has grown big enough, you could feel a lump in your neck or on the side. And so when that happens, that's really the only symptom you would have. Otherwise, they're picked up on a routine physical exam, or generally when you're getting some sort of imaging for other reasons and they see an incidental finding on your thyroid.
Oh, interesting.
We diagnose it based on ultrasound and a biopsy of the actual nodule, which is done either by a surgeon, an endocrinologist, or a radiologist. All different ones of those can do a biopsy. And there's also certain features on ultrasound which make us think that it's going to be a cancer. As for genetics usually doesn't play a role in thyroid cancer. There are a few genetic syndromes where they can be part of it. Generally, we won't talk about that until after you've been diagnosed and been treated, and we take a really good family history. Except for a rare thyroid cancer called medullary thyroid cancer is the only time we may do genetic testing up front before surgery.
Interesting. So maybe it's a little bit different from other cancers in that respect. So let's move on to different types of cancer. Papillary cancer is the most common type of thyroid cancer. Can you give us some background on papillary or PCP and other thyroid cancers?
Sure. So papillary thyroid cancer, as you said, is the most common type, and it accounts for about 85 or probably 90% of all thyroid cancers. It's also known as well-differentiated thyroid cancer, or TTC. The other types of thyroid cancer are follicular thyroid cancer, follicular variant of papillary thyroid cancer, which is a mouthful, medullary thyroid cancer, as I mentioned previously, and the very rare but aggressive form is anaplastic, which only occurs in about 1% of patients. And thyroid cancer, like most cancers, is just an overgrowth of cells that are normally found in your thyroid.
So let's say I was diagnosed with one of those cancers you talked through. What does the treatment look like? What options are there?
Yeah, so the great thing about thyroid cancer is that it's really treatable. Treatment involves, number one, surgery. So there's no medicine, chemo, whatever to get rid of it. We just got to get it out of you. So that's why you come and see me. I'm a surgeon. I get rid of it. After that, depending on if we're taking out half of your thyroid or all of your thyroid, you may or may not go on thyroid medicine. If we take out all your thyroid, you go on thyroid medicine, which kind of actually acts like a chemotherapy without taking chemotherapy, because it suppresses the growth of any new thyroid tissue, which is cool. Some patients need what's called radioactive iodine, which is a pill that also helps sort of kill any remaining thyroid tissue, but we're giving it to a lot less patients these days because we're realizing that a lot of patients don't need it.
Wow, that's fabulous. So if I was diagnosed, what kind of support services might be available for me and my family?
So I think that's a really important question, not just for thyroid cancer, but for all cancers. And it's actually something that is overlooked a lot in thyroid because we're kind of the orphan cancer and generally not seen in cancer centers. But support can come in the form of support groups. There's a really great thyroid cancer support organization called THYCA, which I and a lot of other doctors do talks for all the time. There's special groups for young adults as well as for older people. At the John Wayne, we also have a nurse practitioner that meets with everybody after they're done with treatment to kind of go over a survivorship care plan. And really, you just need to find an endocrinologist and doctors that will listen to you and guide you through it.
I think that's certainly sound advice, having a team that listens to you and guides you through it for anything in life almost. Dr. Goldfarb, thank you so much for your time today and your expertise. It was great talking with you.
My pleasure. Thanks, Lauren.